I think in many ways, COVID was an experiment in innovation and creativity. It woke us all up. In fact, you could actually look at it in many ways, despite all of the bad things that occurred and that people who died and got very, very sick. It was a kick in the butt for a lot of us. I mean, and not just only healthcare. It demonstrated our fragility in many ways. Before COVID, we were all feeling so strong and so wonderful. All of a sudden, things happen and it just wakes you up. And I think it is changing, and it's changed, and it's changing every business. But in healthcare, there's a couple of things I'd just like to mention. One is, one of the reasons that we were unbelievably, I believe, quite affected during COVID was that the government relaxed a lot of regulations. It dispensed with a lot of the rules, allowing us to be unbelievably creative and adaptive. That leads to the question as to whether or not some of those rules that were relaxed should ever again be put back in place. So I do think one of the issues for healthcare and all business is to be able to get government to learn that there is an appropriate role for regulation, but it cannot constrain innovation, creativity. So regulation as an issue needs to be completely evolved and changed, which we're working on. The second thing for healthcare is that we've got to be much more consumer focused. We've been patient focused, and we'll always deal with patients, but patients have traditionally been looked upon as being subservient. To me, patients are customers. And if, as an organization, especially healthcare, if you look upon your purpose as focusing on serving the customer, your whole attitude and perspective changes. You respond to what the customer needs and wants, not necessarily what you want to deliver, but what the customer needs. We have to be on education and training. And we're working on this. We have to spend a lot of time rethinking how we educate people for the demands of the next 5 to 10, 15, 20 years. What are the new skills? What are the new learning modalities? What are the gaps that were demonstrated in the last couple of years? How do we create the workforce of the future? And then on healthcare, it is not all about hospitals. At Northwell, we're a very large system, as you mentioned, Laurie, but only 46% of our business is hospital business. Most healthcare is going to be delivered out in the community into ambulatory outpatient facilities. So the idea is to bring the care as close as possible to the consumer, where the consumer lives, because it is more productive, it is safer, and with the advances of technology and science, we're able to do things today that we couldn't do before.